Hi, my name is Amanda Waterman. I am a professor of psychology at the University of Leeds, and I also lead on cognitive research within the Born in Bradford longitudinal study and also within the Centre for Applied Education Research. And I've also been leading on the theme Inequalities in the Classroom with our colleagues across in the Centre for Population Health Sciences in Stanford. So I'm just going to use this video to discuss some of the things we've been talking about within that group so far and some of the things that we've been interested in exploring. So obviously there are lots of factors that can lead to inequalities for children in the classroom. And I've pulled out some of those here, as I said, that we've been particularly interested in the group to date. Obviously, growing up in poverty, living in deprivation, tends to mean that children are more likely to have poorer longer term and short term developmental outcomes, including education and mental health and well-being and physical health. Having a special educational need, or what's often referred to as a learning disability in the US. So a special educational need in the UK sometimes comes with a formal diagnosis of a disorder like autism or dyslexia or attention deficit, or it can also include children who have a learning difficulty of some sort but don't necessarily have a diagnosis but clearly have difficulties in learning or in the classroom. And then there are children who have health difficulties that they may have had from birth, that they then have when they enter education, and that of course again also leads both learning difficulties and health difficulties clearly mean that children are more likely to experience difficulties within education, both in terms of their academic attainment but just also in terms again of their general health and well-being. And one of the health difficulties we've been particularly interested in the group, because of the expertise and interest that we have in the group so far, is the issue around preterm birth and some of the effects that has on children as they move through into the education system. So unfortunately, we also know that the pandemic that we've all been going through has exacerbated these difficulties. So obviously all of our children have struggled over the last 18 months to 2 years. It's been very difficult having periods of time during the lockdowns where they weren't able to go into school, or a lot of children weren't able to go into school. And the schools have done a wonderful job of having to switch basically overnight to online teaching during that first lockdown and all the stresses and strains that came with that. But it still has been difficult for children to miss that classroom experience, the normal education experience, and it's been even more difficult for children with pre-existing vulnerabilities, such as a learning difficulty, such as health problems, or living in poverty. So we also want within this group to think about the difficulties that have come from being from the global pandemic and how we can also factor that into what we do. So just to talk about some of our broad aims, some of the things that have been driving what we want to do or underpinning what we want to do. So first of all, we're very keen, and this will be true across other themes as well, to link health and education. Often, particularly in the UK, well, it may also be true in the US, but my own experience is obviously within the UK, the health and education can exist in slightly separate silos, but actually it's really important to bring together health professionals and education professionals. So from a people point of view, linking health and education so that they can work together to better support children. But also from a data point of view, often the health systems and education systems don't talk to each other terribly well. So that's something that we really want to do. We're also keen to use our large-scale data sets to explore key questions around all of the things that I've talked about so far in this video. So obviously we have the Born in Bradford longitudinal cohort study following over 13,500 children and their families, and then our colleagues in Stanford also have access to similarly very large data sets on their local population as well. One of the things that we've discussed is we're interested in if we can pull out differences between policy between the UK and the US and find a way of looking at how that may have affected developmental outcomes and how different policies may have a more or less positive effect on those outcomes. And then something else that also underpins what we're doing, and again this will come through in the other themes, is co-production. So we're very keen that the academics and the scientists and the practitioners work together. Of course, some people do both. Some people are academics and practitioners, but we're very keen to bring those groups of people together to work together to better support children, particularly within this theme in the classroom. And indeed, the group as it stands includes academics from across health sciences, education, psychology, and then clinicians and practitioners from both healthcare and from education. And one of the things we're definitely keen to do within this group is to find ways to produce practical guidance and support. We all know that living in poverty and having a learning or health difficulty is problematic for children. We don't just want to be another group that describes those difficulties. We want to also be looking at how we can produce practical support and guidance, as I said, in collaboration, academics and practitioners, to actually support children on the ground, particularly to try and improve their experience of the classroom and to reduce some of these inequalities that children face. We'd be delighted to welcome people into this group, and you don't necessarily have to have interest or expertise in the things I've discussed here. We'd be very delighted to welcome people with different expertise and different interests, and for our group to grow and for us to consider other issues and factors as well. So thank you for listening.